This is Radio Health Journal. I'm Reed Pence. This week, can prenatal fluoride lower IQ?
Here we have the dental community pitted against a public health community that's worried about health risks of water fluoridation and potential adverse effects on the developing brain or other vulnerable populations.
Oral health versus brain health, when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
This week on Viewpoints.
It's just beginning. Whatever growth the hard seltzer category has had this far, I think that there's that much growth still ahead.
The canned spiked seltzer craze this summer could change the beverage aisle forever. Then,
I would rather have my teenagers learn about something difficult in a book than on the internet.
Raising a reader in today's digital world. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Fluoride in community drinking water has been around for nearly 75 years, and about 2/3 of Americans have fluoride in their water. The Centers for Disease Control and Prevention has labeled water fluoridation one of the top 10 public health achievements of the 20th century because it cuts down on cavities so much.
The current estimates are that community water fluoridation reduces tooth decay by at least 25%, maybe more. But this has major implications over a person's lifespan.
That's Dr. Brittany Seymour, Assistant Professor of Oral Health Policy and Epidemiology at the Harvard School of Dental Medicine.
Poor oral health impacts overall health in many ways. So people with diabetes, for example, who have oral disease can have higher difficulty controlling their blood glucose levels, for example. And poor oral health can have negative impacts on people with cardiovascular disease. And it's actually documented that poor oral health has associations with over 100 other health conditions. So there are many associations between poor oral health and how it impacts a person's overall health and well-being. Cavities are the most common disease in children. We do know that they interfere with a child's ability to learn and to focus in school due to the pain and discomfort that they have. A study I was involved in and other studies have showed that children with severe cavities have difficulty sleeping, which impacts healthy growth and normal development. And so these negative impacts that cavities have on children is very well established. So we're not just talking about teeth.
Seymour says you can get tooth-strengthening fluoride in a variety of foods like black tea, grape juice, and seafood. But for many of us, fluoridated water remains important. She says for every dollar invested in fluoridated community drinking water, $38 in health treatment costs are saved. But not everyone agrees. In Europe, for example, only about 3% of people have fluoridated water. And in the U.S., putting fluoride in the water is still sometimes viewed with suspicion, or even as part of a conspiracy.
Public health policies and programs are always controversial, because there's always this balance between individual choice and population-level policy. This is one of our great challenges in public health. And actually, when fluoride was first instated back in the early years, some of the first communities that were fluoridated, there was a notice that your community is going to become fluoridated, and the public health departments started receiving letters from people in the communities far before the fluoridation had actually been implemented. They assumed the fluoridation was already in place, and they were claiming health problems, all kinds of problems before the fluoridation had ever begun. So I think this kind of just comes with the territory.
However, when defenders and detractors already have their minds made up, it's sometimes difficult to let the science do the talking. Seymour says fluoridated water is one of the most well-studied public health programs in history, but some aspects apparently hadn't been studied quite so much.
Most of the studies, and when we're talking about EPA setting regulatory levels, they were looking at health outcomes like skeletal fluorosis or dental fluorosis, which is a common adverse effect of too much fluoride. Those studies are out there. There have been many studies looking at these outcomes of fluoride, but the impact on the developing brain, there were very few. There's some animal studies, but until 2017, there were no studies, at least in North American populations, with lower levels of exposure to fluoride done in pregnant women.
That's Dr. Christine Till, Associate Professor of Psychology at York University in Toronto, author of a controversial study finding that in some instances, fluoride consumption by pregnant women affects the IQs of their offspring at age 3. Judging by estimated water consumption, higher fluoride was associated with about a 3.5-point drop in children's IQ. Judging by measured fluoride in mothers' urine samples, a higher intake of fluoride predicted about a 4.5-point drop in IQ, but only in boys. Till says she didn't know what to expect from the test, only that the results would be important either way.
When I wrote the grant, it was a win-win grant to write because I said, regardless of the outcome, if we don't find any association, that's really important knowledge. Right now we have women calling Health Canada and asking, what kind of water should I drink when I'm pregnant? Are there any concerns? And it's hard to advise these women when we didn't have data on drinking water and other exposures to fluoride in pregnancy. So I wrote this grant thinking, well, we might not find anything. And that's okay because that information will be really relevant to advise women. We need to make decisions based on evidence. So when the data came out and we saw this, I would call it a large effect, especially for the boys, it was surprising, but on the other hand, maybe I shouldn't be so surprised.
That's because her study was in many ways a replication of a Mexican study, and she says animal studies hinted at some of the same possibilities.
We know that animals rats that are exposed in pregnancy have their offspring showing adverse effects, specifically in the male rats, not in the females, at least when it comes to prenatal exposure. So this is an important observation that we are now seeing in the human population that we found. We know from other exposures like lead and BPA that boys are more susceptible to exposures, at least prenatal exposures, than girls. In fact, in the exact same population, this Canadian population that was recruited as part of the MIRIC study, another paper that studied lead showed that the males were more susceptible than the females in the exact same population. So there's something about males. We also know males are at greater risk of having neurodevelopmental disorders like ADHD, learning disability, autism. So there's something about males early in development that may put them at greater risk.
Despite that background, such a challenge to the safety of community water fluoridation can't be taken lightly. The journal JAMA Pediatrics, which published the study, admits the decision to do it was difficult, and editors subjected the results to more scrutiny than usual to make sure they held up. Till wasn't surprised.
I mean, it's expected. This is such a controversial area. The data are hard to believe. We have a lot of people doubting that the effect is real or questioning the significance of 4 IQ points. We've heard it all. And I mean, on one hand, I'm so used to this from the very beginning. To do this research, it was difficult. To get it funded was difficult. We're used to the scrutiny. And looking back, I think it was the scrutiny that made our study more rigorous because we knew we would never be able to get away with 1 urine sample, for example. I needed 3. I had to make it work because if there was a hole in the methods or something that we did that wasn't up to par, then it wouldn't pass.
Despite the extra rigor, Till is correct. There's been plenty of pushback. Dr. Patricia Braun is professor of pediatrics at the University of Colorado and chair of the American Academy of Pediatrics Section on Oral Health Executive Committee.
This is one study that it is a level of evidence, but it's low. It's showing an association with one part of the IQ test of 3-year-olds, and that it is hard to interpret the impact of a 4-point IQ change, especially only in performance IQ in boys, and that we would encourage the authors to follow these kids forward if they can, and then to do some more rigorous adjustments with other variables that we know impact IQ. I think the authors will note themselves that in the majority of their analysis that they don't see any change in IQ. So we need to be careful about pulling out the few results that are significant when the majority of results didn't show significance. But as I said before, we welcome all science.
Seymour is skeptical as well.
When I'm looking at a study, it doesn't carry enough weight that I would want to make changes or see changes until it can be replicated. Science is a process, not a single study, and it's a process that takes many years before definitive conclusions can be drawn, if ever. So what I've been saying, my current recommendation is be skeptical of anybody making strong claims or recommendations based on this paper, either confirming or dismissing its findings. And as the editorial states, quote, we need dispassionate and tempered discussion. And I totally agree.
Till agrees as well, but she says the evidence is stronger than just her group's study.
Of course, no one study is definitive. I absolutely agree that policy is not based on one study. But now we have two well-done studies with biomarkers, with standardized IQ tests done on a large sample using rigorous methodology and control for important covariates. So that's important. We have that in addition to dozens of studies that have been done in other countries like China, where there are high levels of naturally occurring fluoride. So we need to look at all of the evidence in the human epidemiologic literature as well as the animal literature and base policies on this growing number of studies.
But even if the study is confirmed, how should we weigh the risk of fluoridated water for pregnant women versus the benefit? How much evidence is enough to do something differently? Till says each side has an argument.
Here we have the dental community pitted against a public health community that's worried about health risks of water fluoridation and potential adverse effects on the developing brain or other vulnerable populations. You have the dental community promoting water fluoridation programs as an effective way of reducing cavities. You can't blame them because it's their job to care about people's teeth and oral health. And even our dentist on our team, she is very strongly opinionated about the importance of oral health, and that's her job. I'm a neuropsychologist. I see things differently through my lens. Anything that can potentially affect the brain, for me, is of concern.
Till says that's the case, especially if we have ways other than fluoridated water to prevent cavities in pregnant women. Meanwhile, she says the fetus gets no benefit and all of the risk.
This is not controversial. There is zero benefit of fluoride to the fetus, and that's not controversial. All dentists, everyone can agree that we do not supplement pregnant women with fluoride supplements anymore like they used to, because that has been disproven as a means of strengthening enamel. We know that does not work. There's absolutely zero benefit to the fetus of fluoride.
So where does all of this leave us? Probably in a cautious state. However, no one is suggesting that fluoride should be taken out of our water. It does have substantial benefit. Till is suggesting only that pregnant women avoid it. But Seymour still needs more convincing.
I'm a mother. If I were pregnant right now, with my knowledge and background in health and science, I personally wouldn't be making any changes right now necessarily. I'm honestly just not that concerned yet. But that's me. I would say if pregnant women and their health care providers are concerned, that they can make those adjustments in their diet. And, if they really are concerned about fluoridated water, bottled water is an option. However, that can be cost prohibitive for many pregnant women.
Other advocates for fluoridated water have been firmer in their rejection of the study and of the need for more research on the issue. But Till says if we dismissed all observational studies like this one, we'd still be fine with drinking and smoking in pregnancy. Well-done scientific research may indeed suggest policies, but it doesn't mean it has an agenda. You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence.
The arrival of the fall season can bring nice weather, more predictable schedules, and a variety of new activities. Eating healthfully is essential to managing the new normal, and strategic snacking can make all the difference. Registered dietitian Courtney Romano is a health advisor for the California Table Grape Commission.
Healthy snacks are a great way to maintain energy levels during a busy day. So plan ahead and choose snacks that can go wherever you go. Take fresh grapes, for instance. They're easy to pack, they're healthy and hydrating, and they provide energy and great taste just when you need it, whether after school, at the office, before a workout, and more.
Grapes from California are in season now. Grapes of all colors, red, green, and black, are a natural source of beneficial antioxidants and other polyphenols, which research suggests contribute to a healthy heart. Visit grapesfromcalifornia.com for more grape snacking ideas.
Paid non-attorney spokesperson paid for by the Sentinel Group. Attention military vets and current soldiers who served between 2002 to 2016. Have you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces? You may be entitled to compensation. 3M, the manufacturer of earplugs made for combat, recently paid the government $9.1 million to settle a False Claims Act case for knowingly selling these defective earplugs for over a decade. Specifically, the United States argued that the manufacturer knew their earplugs were too short for proper insertion into users' ears, and that the earplugs could loosen and therefore didn't perform properly or reduce noise the way they should have. If you or a loved one suffered hearing loss or tinnitus after serving or while serving in the U.S. Armed Forces, you need to choose the right legal team that has the experience, support staff, and resources to seek the most compensation for your injuries. Call the Sentinel Group now for more information and a free case review. Call 800-655-6458. 800-655-6458. That's 800-655-6458.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this broadcast, please support our show by subscribing, sharing it with a friend, and leaving a review on Apple Podcasts. You can find more Radio Health Journal stories about health, science, and technology on Apple Podcasts, Google Play, Spotify, and RadioHealthJournal.net. Also, follow us on Instagram and Twitter at Radio Health Journal.
Coming up next week on Radio Health Journal.
It's something to be very concerned, and I think it's an indicator that we are shifting risks that lead to poorer outcomes.
Why rural hospitals are closing their maternity units.
Then how kids' allergies and asthma often start with dry, cracked skin.
When your skin is defective, then foods that are in the environment can come through the skin.
All that and more on Radio Health Journal.